Being a doctor, I thought I knew what patient-centered care meant. But here's where my perspective changed, when I became my mom's caregiver during her hospital stay. It's a story that reveals the gap between theory and practice in healthcare. As a doctor, I accompanied my mom, an elderly, hard-of-hearing, non-English speaker, for a medical procedure. I quickly realized that being a patient or their advocate is a whole different ballgame. From the moment I struggled to find parking, I knew this experience would be eye-opening. The admission process was a challenge. The clerk's frustration with my mother's missing health card was palpable, and I found myself translating and problem-solving. The nurse's questions, filled with medical jargon, left my mom puzzled, and I wondered how many patients simply nod along, trusting the process. And then, a priest appeared, adding a touch of comedy to the situation. But the real revelation came when I ordered jelly for my mom, only to be denied due to a mistaken allergy label. This incident highlighted the unnecessary barriers patients and caregivers face, often due to bureaucratic processes. It's a stark contrast to the ideal of patient-centered care, where their needs and preferences should be at the core. Susan Sontag's words from 1978 still ring true today: "We all have dual citizenship in the kingdoms of the well and the sick." Healthcare providers must not forget this, ensuring that their focus remains on the patient, not just the paperwork. True patient-centered care requires more than checklists. It demands empathy, understanding, and a willingness to adapt. Australia's healthcare system performs well globally, but we can't become complacent. We must continue striving for patient-centered care, which means questioning long-standing practices and ensuring that every patient's unique needs are met. And this is the part most people miss: it's not just about the medical treatment, it's about the entire experience. So, as a doctor, I now understand that guiding patients through the healthcare system requires more than medical expertise. It's about being an advocate, a translator, and sometimes even a comedian. It's a privilege to be able to make a difference in someone's hospital stay, and it's a lesson I'll carry with me throughout my career.